Cancer is always seen as an adult disease. However, every year there are thousands of children that are diagnosed of cancer worldwide. And the most common mistake often that parents make is to assume that the symptoms of their children cannot be cancer because my child is young. So today, let's talk about important signs and symptoms that parents should not ignore in their children. My name is Dr. Kpatsi, and in recognition of International Childhood Cancer Day, I would like us to discuss how some childhood cancers do present. It's important for me to state that most childhood symptoms that parents will notice in their children are not cancer. However, persistent, unusual, or unexplained symptoms often require further evaluation, and it's best for parents to always seek clarification from their healthcare providers or their pediatricians when they notice these unusual symptoms in their children. A very important sign and symptom that I want to talk about first is persistent fever. It is not always that every fever in a child should raise alarms of cancer. However, if your child's fever is recurrent, prolonged, and more especially if the child has gone through antibiotics for the required duration, but the fever keeps recurring, this will require some evaluation. This is because we've had some cases of leukemia in children presenting in this fashion. So, if you've noticed such symptoms in your child, it's always important to have a discussion with your pediatricians so that your child can be evaluated. Another important sign and symptom that I would like to talk about is unexplained weight loss. It is not unusual for children to fluctuate in their appetite. However, if you've noticed unexplained weight loss in your child, especially if it is not associated with any known illness for which the child is having the weight loss, this is of concern and must be evaluated to rule out any underlying illness or, in this particular case, any type of cancer diagnosis. A very important sign and symptom that you should not ignore in your child is pallor or unusual or unexplained weakness. A child who becomes weak, looks pale, may usually have anemia, and most of the time some cancers such as leukemias can present with anemia, and because of that it's always important that if you have an unexplained anemia, you get it evaluated by the pediatricians so that they can rule out any underlying cause. It is not abnormal for a child to have some bruising if they fall down and get hurt. However, when a child has persistent recurrent bruising, especially that which is not associated with reasonable trauma to warrant that kind of bruising, and this keeps recurring, this is something that must be evaluated because we have had cases of leukemia presenting in this fashion. So if you've noticed any such symptom, it is important to see your pediatricians and get your child fully evaluated. So another important sign and symptom that should not be ignored is persistent bone pain or joint pains, especially if this is the type of pain that keeps your child awake at night and it continues to be at the same location, and more importantly, if it is not associated with reasonable trauma. This is something of concern. And even more when you notice that this particular pain is associated with a swelling at that site that is not related to a known reasonable trauma. This is something that must be evaluated. We have seen children who present with persistent bone pain as a result of tumors in the joints or in the bone. So this is not to say that every pain in the bone is cancer. However, if you have pain in the magnitude as I have described, this is something that must be evaluated and completely treated. A key sign and symptom that you should not ignore in your child is swollen lymph nodes. This is even more important if those lymph nodes are hard or firm, they are painless, and they tend to be persistent and they are increasing in size over time. This is something that must be completely evaluated so that you rule out any underlying conditions. Occasionally, your child may have some headache as a result of a minor illness. However, if your child develops a headache that is recurrent, and even more importantly, if this headache is associated with visual changes, if I say visual changes, I mean blurred vision, it's associated with vomiting. These are signs and symptoms that can sometimes be associated with brain tumors. So if you have something like that, you should report to the facility and get evaluated. There are also times that these headaches may be associated with weakness on a particular side of the body, or it can even be associated with some slurring of speech or other gait abnormalities. So these signs and symptoms must be evaluated as soon as possible. You should not ignore this particular one. When your child has a white reflex in the eyes, especially when you look at a photograph that they've taken, this is something that can be of concern. We've had cases of retinoblastoma, which is a common cancer of the eye presented in this fashion. So when you have your child's photograph and you're admiring them, don't forget to look closely. Perhaps you may be able to make a diagnosis just by looking at a photograph of your child. Another key sign and symptom is abdominal swelling. If you've noticed an enlargement of your child's abdomen or belly, this is something that you must let them be evaluated in the hospital, especially if it continues to increase in size. And if you've noticed that there's some form of hardness in the abdomen that does not go away, but rather increases, that is something that you must take your child to the hospital and get it evaluated as soon as possible. Now, let's be clear about this. These symptoms are usually caused by non-cancerous conditions. However, when these symptoms become persistent, they are often red flags that must be thoroughly examined and evaluated to rule out any other underlying conditions. So what should you do when you notice any of this? Remember not to panic. Try not to rely on just Googling out whatever the cause may be and then leave it there, but take your child to the hospital and get your child evaluated by a specialist so as to rule out any underlying causes. If you feel your symptoms or your child's symptoms are not being evaluated enough, you can ask for a referral or seek a second opinion if need be, because sometimes by seeking a second opinion, you might get another individual to give you their perspective, and who knows, that might be the solution to your concerns. So here is an encouraging truth that I want you to bear in mind, that many childhood cancers are treatable and majority of them are also equally curable when they are diagnosed early. Don't forget that early diagnosis saves lives. If you found this video helpful, don't forget to share, like the video, and also subscribe to this channel so that you don't miss subsequent videos. See you in my next episode.